Hi everybody, Dr. Sia here. We're about to watch a session between myself and Anna. Now, Anna is depressed, but also she is constantly locked up in something we call externalizing. Now, I'm not going to explain too much that is in case you're curious about finding out about externalizing and being able to see it yourself. So I don't want to do any spoilers here before we watch the session. But make sure you stay put for the session because afterwards I'll be doing a wrap up and I'll be explaining why I did what I did, why I said what I said, and the kind of things that I saw, and you'll get a chance to do your input too. So stay put and I'll see you soon. Anna, what are the problems that you've been having?
I guess I'm depressed. That's what my doctor said, and my partner. Yeah.
Your partner said you're depressed?
Yes. Yes. He says that I'm too much angry and I worry too much, and he thinks I'm very irritable. Yeah.
And I noticed that I asked you what problems you think you're having. And you're describing that your partner thinks you're depressed and that your partner thinks you're irritable.
Yes, and my doctor too.
And your doctor too.
Yes.
Um, do you think you're depressed?
I guess so. Yeah.
You're saying that you're guessing.
Yes.
You're not quite sure.
Yeah, I mean, like the feedback that I'm getting from other people, like people who are important to me, like my partner and um, and the doctor. I mean, I trust that he's got a degree and he's knowing what he's doing. And their feedback is that this is how I am, and yeah, this is why I'm assuming that there must be something.
Yeah. So you're saying that your partner has given you some feedback that you're depressed, and
Yes.
your doctor, who's obviously a trained person, has
Yeah.
told you that you're depressed, and so it must be the case.
Yeah, I think so. Yes.
And what about yourself? Do you think that you're depressed?
Yes, I think that I'm depressed because this is the feedback that I'm getting. That what makes me believe that it's true.
That's right, yeah.
Yeah.
It seems like you're relying on the feedback alone,
Yes.
on what you've been told alone.
Yes.
What about your own ideas about what's going on for you?
Yeah, I think I don't really feel happy. Yeah, that might be an indicator.
Yeah.
I think.
Yeah. When you say you're not happy, is there anything else happening for you that makes you think that you might be depressed?
Um, yeah, I feel like I used to be much more happy before my relationship, like a few years ago. Um, and also my friend, she noticed that I'm not a good friend to her anymore. She has she has a lot of issues. She's got an operation coming up, and um, yeah, I think she expects a lot of support because she's going through hard times, and she's having those operations on a regular basis, like every 3 4 years, and she needs me, and she's telling me that um, she expects me to be more there for her.
Yeah.
Because it's really hard time.
Okay.
For her. And yeah, and it's hard for her because she doesn't get the support that she needs in that operation with her partner or with her parents.
Sure.
They're not really giving it to her.
Okay.
Yes.
I'm just noticing, Anna, that I asked you what you think is happening for you. And you say that you might be depressed and that you're not as happy. And then you're talking about all of these things that are happening for your friend.
Yes.
It sounds like really difficult times for her.
It is, yeah.
I'm wondering, do you see how that necessarily doesn't speak to your depression? That what's happening for your friend and her surgeries doesn't necessarily say how you are experiencing your depression.
Okay.
Do you see that?
Yes, yes. I guess I'm focusing on other people a lot.
That's
This is what you say?
That's right. Well, it seems like I ask you what your depression is or what your problem is, and you say that your husband thinks that you might be depressed, that your doctor thinks that you might be depressed, and now you're talking mostly about what's happening for your friend, and I understand that that's distressing to you as well. It seems like you care about your friend a lot, but it doesn't necessarily say what symptoms and signs of depression you are experiencing.
Mm-hmm.
Do you see that?
Yes, yes, yes. Now that you're saying yes.
Okay. So if we focus on the feelings or the symptoms of depression that you are having,
Mm-hmm.
what are the symptoms of depression that you are having that makes you think that you are depressed?
I think, yeah, I don't sleep that well.
Oh,
And yeah, my eating habits a bit funny.
okay.
Like sometimes I'm really hungry and eat a lot of food, and then I'm not hungry for hours and hours.
Sure.
Um, yeah, and yeah, like the eating thing causes issue because my partner likes to cook,
Right.
and then I'm not hungry because an hour before I ate so much, I was so hungry and ate so much, and then he cooks for me, and I can't eat it, and it makes me feel guilty, like I feel like he did all that effort for me, and I need to enjoy it and to show him like he's a great cook and how yummy it is, and I'm just too full
Yeah.
to even try it.
Yeah.
Yeah.
And it sounds like your partner will be quite distressed
Yes.
when that happens.
Yes, absolutely. Yeah.
And what about for you? What's that like for you?
Yeah, yeah, I don't want to disappoint him.
Mhm. And what's that like for you when you can't give that to your partner? What you want to give him? How do you experience that?
I guess I feel useless. Like,
Then something comes along and tells you that you're useless to him.
yeah, because all I want to do is having a good relationship with
Sure.
my partner, so I need to contribute
Sure.
to this relationship. And if he's doing things for me,
Yeah.
then my part in the relationship is to give it back.
Right.
I think.
Yeah. And it sounds to me like what you've described so far is that your eating habits are a bit off and that you have some problems with your sleep as well, but that also these ideas that you might be useless.
Yeah. Yeah.
Are there any other signs of depression there for you?
Oh, look, I haven't thought about what depression is. I thought that, because a few people told me that I come to you and you can make a diagnosis and tell me like
Sure.
what's wrong with you,
That's
because
right.
you I guess you know what a depression is a lot better than I do. So
Well,
I actually wanted to ask you, what do
yeah,
you think?
yeah. I wonder if there's two parts to that. I wonder if some part of that is that I might know a lot about depression. But I wonder if there's some part of you that also wants me to know more about you than you know about
Look, I can't know everything.
you. No.
Like, this is why we,
Yeah,
have different people who are helping us.
exactly.
And yeah.
But when it comes about you, though, and how you are experiencing things, I can't know more about how you are experiencing things than you do.
Okay.
Does that make sense?
Yes.
So if we look at how you are experiencing your depression,
Hmm.
what are other signs and symptoms are there for you?
So, um, yeah, I think just that I'm not enjoying life like I feel like other people do and I don't.
Yeah. It does sound like that one was quite emotional for you.
Yeah,
I noticed that you got a bit anxious when you said that.
I think so, yeah.
Do you think that it might be important for the two of us to keep looking at this depression that you're experiencing together maybe next time?
Yes.
All right, so that is session one with Anna. Wow, okay. I mean, did you pick up on this externalizing that was happening there? So let me tell you what externalizing is. So when I asked Anna, what are the problems that you're having? She kept saying that she believes that she's depressed. Well, not really. Other people have told her that she's depressed. Now, this form of externalizing can mean many different things, but this form, she's basically saying her belief, her ideas about whether she's suffering or not, about whether she's ill or not, about whether she should get better or not, are in the hands of other people. Almost like saying, well, if it's up to me, it doesn't really matter, but hey, everyone else thinks I'm depressed, so maybe I should do something about it. That's a barrier to improving from therapy. That's a barrier from actually engaging with yourself. Because you can see, if you're constantly thinking, well, look, it doesn't really matter to me what happens to me, I'm only doing this for other people, well, that almost keeps you in a position where you go, well, what about when it gets really tough? What about when you need to make some really big changes in life and you really need to work on yourself really hard to benefit from therapy? What about then? Is your motivation going to hold? Are you going to do all those things because someone else told you to? And most likely, the answer to that is no. So, what we really want to help Anna see is that whatever she believes, whatever's going on for her, is very important. And if she can then believe that she's depressed or not, but whatever she believes, if she can hold that belief herself, then we have an in and we've removed a big barrier to therapy and we can help her start benefiting from the therapeutic process. Now, I'm really curious about what your ideas are about what Anna could possibly benefit from, what type of therapy you would use, how you would do things if you had the chance. I myself, I did the things obviously because I'm seeing it from a certain view. Maybe you have a different view. Look, stay put for session two. It's going to be posted soon. And for now, remember to subscribe and like, put a comment. I love to read your comments and I'll reply as soon as I can. I'll see you again next time.